Hello friends, welcome to Medicine Hub 101. So today we'll talk about the from the aspect of the topic that is pharmacology. So within the pharmacology we'll talk about the cardiotonic drugs and today's topic is the angina pectoralis. So first of all we need to know what is angina. So pectoralis, it's like in the pectoral regions, okay. In the pectoral regions, we know there's pectoralis major muscles, pectoralis minor muscles, all the things are there. So whenever the heart is unable to pump or to supply the blood within that particular regions, at the time we just feel sometimes pain, okay. So that type of the disorders, that is known as the angina pectoralis. Now basically the angina is divided into two parts. One is classical or exertional and is variant or vasospastic angina pectoralis. Now let's talk about the classical. In the classical, let's consume this the red portion. This red portion is just this one. Let's take it as like the heart, and within the heart we know there is like coronary arteries, and if within the coronary arteries, for suppose for any kind of any deposition, so like thrombus like things, it may be for the atherosclerosis, or it may be for any other regions. And whenever there is a deposition of these things, then the that enough amount of the blood, for suppose the blood will come out through this, that enough amount of the blood they will be unable to pass through this region, so this part will get not the sufficient blood, okay. So there, as a result, there will be formation of the ischemia. So the patients feel but one thing we know, that if the patient is having the angina, the patient may not feel the pain. Why? There is a reasons, because whenever there will be formation of the ischemic things or ischemic conditions at the time, our body is having the compensatory mechanisms, like what, the formation of the nitric oxide or something, such types of the vasodilators as reasons. What we will see there is like the, for suppose, let's see, for suppose the the thrombus is here, or okay, for what the blood is unable to go here, as a region there will be formation of the ischemic condition in this region, so blood will be not enough here. So as a result, what, by the process of the compensatory mechanisms, by the formation of the nitric oxides, maybe other things, there is the vasodilators, it will get dilated. So the enough amount of the blood then will go in these regions. Okay, so the patient will not feel any type of the pain in this case. Now, on if we just talk about these things, okay. So the ultimately we can say in the point term, the vasodilation by ischemia. Whenever there will be ischemia, then this stimulus will be, for this stimulus there will be formation of this stimulus. As a result, there will be formation working of the vasodilators. They will be dilated, and enough amount of the blood they will just pass through these regions, and we will go to the particular regions where is the deficiency of the blood. Okay. Now, how to do the treatment for it. Now we have to think about the treatment. Now we're saying what, that the heart is unable to pump. The heart is, that means that we can do one thing, we can just increase the blood supply. So we can increase what the treatment, maybe we can increase the blood supply, or one more thing we can do, that we can just decrease the work of heart. If we just decrease the work of heart, then we can just do the treatment for these conditions. Okay. Now see one thing, whenever, okay, for suppose the patient, there is a patient who is having like classical angina, okay, there is a patient who is having classical angina and he is trying to do exercise. At that time we will see, okay, that whenever he is doing exercise, at the time he needs to have more amount of the blood, okay, because we need more amount of the oxygen at the time for doing the muscular activities and many other things as well. So at that time, for suppose this blood vessel will get dilated maximum. After that also some amount of the blood that will be deficient, because we are doing exercise, but during exercise we need more amount of the blood. So at that time the proper amount of the blood that will be not able to go in these regions, as a result we will feel pain. So that's why I wrote it here, during exercise, okay, it can't get dilated, because it cannot get dilated. Why? Further, because it is already dilated maximum, okay, further it cannot be dilated. So as a result, inadequate blood will go in this region, so there will be formation of the development of the chest pain, that is, okay, angina. Now I said the treatment maybe 2 days we can just increase the blood supply, okay. And one more thing we can do, that is the work of the, okay, we can just decrease the working of the heart, okay. So work of heart can be decreased by these two treatments. We can just we can feel better for the patients, okay. Now see one thing that's in case of blood supply, as maximum already there is maximum dilated. After that we can dilate it further. So as maximum dilated, so drugs will not work here. If we just if we just give any drugs which will just do what, there will dilation of the vessels, then it is already maximum dilated by the process of the ischemics. You know, whenever the stimulation will be activated for the ischemia, it's already dilated maximally. But if we just give drugs, then it cannot be dilated further because it is maximum range. Okay. Now we have to do what we can do. We can decrease the work of the heart. We can decrease the work of the heart in these cases. So this method is used in the clinical angina, or in the clinical classical angina pectoralis. So in case of the, now let's see one thing, in case of the variant angina, what is seen in the variant angina? In variant angina, the problem is little bit different. What will we see? Then we will see there is like the constrictions of the vessels, constriction of the blood, you know, blood vessels for the coronary arteries in the main regions, and there is constriction. Then we will see what vasospasms. Okay, there is like the, it's coming like this. There is formation of the vasospasms. Okay, so as the regions we can show what or vasoconstrictions. Okay, so we'll see. So whenever the blood, actually the main problem is here, so enough amount of the blood will be unable to go in these regions, why? Because there is a problem. There is the, if the, you know, if you want to remove the situation, if you can remove the situation, then the patient will feel better. Now see one thing, in this patient they will feel pain, because in these cases there is embolus or formation of the anything like for narrowing of the blood vessel lumen, but the amount of the blood that could go, because for the purpose of the dilations, for the, you know, compensatory mechanisms of the dilation. But in this case there is no compensatory mechanism because it's already vasospasms for the arteries, they are getting connected together, so the, you know, enough amount of the blood will not be able to go in this region. So in the resting conditions also the patient will feel pain, but in case of classical angina, the patient in resting condition he will not feel any type of the pain, but when he will do exercise at the time he will feel pain. But in this case, in the variant angina, there will be no problem. Okay, so I already talked about these things. Now we'll talk about the drugs in the next video subsequently. Okay, so it's this video was the part 1 of all about the what is angina pectoralis and the types and how they are classified, how they are different from each other. In the next video we'll talk about the drugs, okay, used in angina pectoralis.